So unfortunately, epilepsy-associated stigma is really quite ubiquitous. Doesn't matter where someone with the condition lives, they're going to experience a certain amount of stigma. If you're fortunate enough to live in a high-income country where there's legislation to protect people's rights, so we have, for example, in America, the Americans with Disabilities Act. You can't discriminate against somebody based upon a health condition of that nature. You have some protections, so you're less likely to have sort of overt discrimination and prejudice, but you're still going to experience things in your life, rejections, microaggressions, that often result in people with epilepsy having sort of a self-stigmatizing, where they constrain what they do, how they put themselves out there, the risks they take, the opportunities they seek, because they want to really avoid such a negative life event as being kind of stigmatized overtly. In lower income countries, where these protections are less common, and there are a lot more misperceptions and false beliefs about what causes epilepsy, those settings we get circumstances of very overt discrimination and violation of people's basic rights. And in those settings, that's probably the biggest challenge. It includes things like being excluded from employment, being excluded from educational opportunities, that just simply having epilepsy is the grounds to be ejected from public education, social rejection and ostracism, not being allowed to eat with the family group, things like that are very devastating on a personal basis. So across the spectrum, the severity and the manifestations vary, but stigma has a huge impact on people's life, quality of life, and really their attainment of all the basic goals of being able to care for themselves and being able to live a happy existence. The stigma goes beyond just interpersonal problems, though. We have a lot of issues with structural stigma, even in the West. And what do I mean by structural stigma? The investments in stigmatized conditions like epilepsy being not equal to the burden compared to unstigmatized conditions. That includes the health systems that are made available, investments in things like medications, and in low-income countries, it's very problematic. We know from World Bank research that epilepsy is amongst the top 5 most cost-effective conditions to treat. You would think investments in something of that nature would be a priority, and yet in many settings, epilepsy is very deprioritized, and even the most basic therapies aren't properly provided. They may be provided on paper, but I can say in virtually every place I've lived in Africa, frequent stockouts of very inexpensive medications really present a challenge for effective treatment for folks. The health system itself might place epilepsy care within the mental health sector that is also marginalized and underfunded. So people have the burden of sort of individualized aggression and rejection, but the system itself is really set up to disadvantage them seeking care, accessing the care they should have relative to the resources within the system. It really happens at every level. In terms of how we address this, historically, through good intentions, there were a lot of mass social marketing campaigns. Those are a problem for a few reasons. First of all, there's no data they work. So that's a good reason not to do them. But they're also very expensive and really not sustainable. And so we know that we really have to think more individually about what drives certain entities to stigmatize. For example, in Zambia, we did studies and we found out sort of drivers of stigmatizing behaviors is very different for different groups. Employers have different issues than the police. Police have different issues than healthcare workers. Healthcare workers' number one reason for stigmatizing is at its heart not being comfortable taking care of the condition. So what do you need to do? You need to improve education for healthcare workers. I think that sort of focus of really educating the people who are supposed to help support and take care of this population of patients is really critical and is a large part of why we're here today.